Urgent fetal surgery is a procedure that can be done while a pregnant woman is still pregnant with her baby. This type of surgery is performed when a pregnant woman has a medical problem that cannot be managed by expecting her pregnancy to continue. Urgent fetal surgery may be used to diagnose and manage problems such as a fetal heart defect or a blockage within the umbilical cord. It can also be performed to treat conditions such as a neural tube defect or delivery of a baby with anencephaly. Urgent fetal surgery may involve minor procedures such as amniocentesis or a shunt placement, or more complex interventions. Prior to performing urgent fetal surgery, doctors will do a test to assess the health and development of the baby, such as an ultrasound. The baby's heartbeat and umbilical cord blood flow will also be checked. Depending on the health of the baby, the doctor may recommend further tests or an urgent fetal surgery. After the health of the baby has been evaluated, a cesarean delivery may be performed or a less invasive procedure such as shunt placement. This type of surgery requires a general anesthetic, making it a very hazardous procedure for both mother and baby. The doctor will make a decision as to the safest method possible for the procedure, depending on the urgency and condition of the baby. After the procedure, the mother will stay in the hospital for monitoring and will be provided with any necessary pain relief or medications. Depending on the type of urgent fetal surgery, the baby may require extra care after the surgery, including oxygen, ventilation and intensive care. After the procedure is complete, the mother and baby will need to be monitored closely in order to check for any signs of infection or complications. The doctor will advise the mother on the best course of action for recovery, such as bed rest, dietary changes and other instructions. Urgent fetal surgery is an option for mothers who are facing a serious medical problem that cannot be managed by continuing the pregnancy. It is a risky procedure but is sometimes the only option for the health of the baby in order to correct the problem. The procedure requires careful evaluation and consideration from doctors as to the safest way to perform it and monitor it afterwards. The risks associated with the mother and baby should be discussed before the surgery takes place so that the mother is aware of the consequences. The outcome of the surgery will depend on the medical problem and the health of the baby, but it can be a life-saving procedure for both the mother and the baby. Recovery time from urgent fetal surgery will vary depending on the type of procedure and the health of the mother and baby after the procedure. The recovery process for the mother may include bed rest and dietary changes along with medications to help her manage the pain. The recovery process for the baby may include oxygen and other treatments as needed. After the surgery is complete, the baby will continue to be monitored for any signs of infection or other complications. The doctor may recommend follow-up care, such as a sonogram or MRI, to ensure that the problem has been corrected.